Thank you for joining us today for a discussion about COVID-19 and Elon University for the fall 2021 semester. I'm Jason Husser, and I'll be moderating our discussion today. I'm an associate professor of political science and policy studies and chair of academic council. I've been working with others in this discussion since summer of 2020 as a member of the Healthy Elon Committee. The purpose of our program today is twofold. We hope to answer many of the questions Elon has been receiving over the past couple of weeks. We also want to provide accurate and timely information, especially as we approach Family Weekend and prepare to welcome a large number of visitors to campus. I'd like to start by introducing our participants today. Marquita Barker. Marquita is Assistant Dean for Campus Life and Director of Residence Life. She's also a member of the Healthy Elon Committee. Jana Lynn Patterson, Associate Vice President for Student Life and Dean of Students. She's a member of Elon's Infectious Disease Response Team and Elon's COVID-19 Data Committee. Kelly Schumann. Kelly is Associate Vice President for Human Resources, a member of senior staff, and a member of the Healthy Elon Committee. Jeff Stein. Jeff Stein is Vice President for Strategic Initiatives, a member of Elon's senior staff, and chair of the Healthy Elon Committee. You've all gotten a lot of emails from Jeff Stein over the last year. We've gotten questions from several sources in recent weeks. We've received submissions from the Student Government Association, from Staff Advisory Council, from Academic Council, from questions to the university's Healthy Elon email account, as well as many calls to the Healthy Elon information line. So we've consolidated many of these questions into themes, and I'm going to be directing some questions to our panelists. We're going to try to get through as many questions as we can during our session. I'd like to start with a question for Dr. Stein. We'll begin with a question we've been hearing a lot on the Healthy Elon information line. Dr. Stein, can you share additional details about the COVID case count on campus? Specifically, how many of the people are vaccinated versus unvaccinated?
Thank you, Jason. Appreciate your involvement in this work over the last couple years. And let me start by saying it's important for us to think about the size of our community in terms of vaccinated and unvaccinated. So we have over 6,000 undergraduates, for example, who are vaccinated. That's about 96% of undergraduates. The size of the unvaccinated population is much smaller. It's about 230 students. So let's say 4% of undergraduates. So you have a much bigger number of the vaccinated, and more of our cases naturally are being seen in that vaccinated population. But percentage-wise, we're actually seeing a higher positive rate among unvaccinated students. So of our confirmed positive tests so far, about 20% are unvaccinated students. It's not that surprising because the Delta variant is so contagious. But it's just important to keep in mind a lot more vaccinated students, so more cases, but the percentage is much higher in the unvaccinated population. And I'll just add one thing about this notion of breakthrough cases or cases in the vaccinated population. Sometimes people think it's that vaccines are supposed to stop all infections. And actually, that's not the purpose of vaccines. They can't do that. Vaccines are really intended to stop us from experiencing serious illness, hospitalization, or death. So what we're seeing is that the vaccines are working very, very effectively in keeping the case numbers down, but also in keeping the seriousness of the illness down because we're seeing very mild cases among our populations.
Thank you, Dr. Stein. That's very helpful for us to know. We've had several questions from students, faculty, and staff related to testing on campus. As folks know, all unvaccinated members of the community are required to undergo weekly COVID testing, but we've been getting a lot of questions about why we don't test everyone on campus on a regular basis. Dr. Patterson, would you talk with us about testing issues on campus?
Sure, Dr. Husser, and certainly we understand that these are trying and anxious times for folks. But I would first say that the CDC does not recommend regular surveillance testing for vaccinated people. It's not a good use of testing resources, which are again in short supply, and there's no epidemiological reason to do widespread testing on a highly vaccinated community like Elon. And that is certainly has been reinforced by our state and local health authorities as well. We know this represents a change in our approach from last year, but we didn't have vaccines protecting against, as Dr. Stein said, those serious illnesses and hospitalizations or death. Because of the high transmissibility of the Delta variant, and we know we have members of the community and their families at home who cannot be vaccinated and who may be immunocompromised. We've also added some additional layers, though, of safety, including mask wearing on campus, to provide an extra layer of protection for folks. We have increased testing for several populations, and so we actually are doing a lot of testing on campus. So anytime a student who isn't feeling well can participate in our walk-up symptomatic testing in the Ellington Center, and that's open 7 days a week. Faculty and staff with symptoms can contact faculty, staff, health and wellness, or certainly their own healthcare provider. And we also have provisions for students, faculty, and staff without symptoms who want to test, including those who are caring for those more vulnerable populations who can't be vaccinated, children, other immunocompromised folks. And they can attend the walk-in testing in the Oaks. Again, we want to be clear, though, that the Oaks testing is for those folks who are not symptomatic, and Ellington Center is for those students and faculty and staff, because we are co-housed in the Ellington Center who are symptomatic. Our student athletes are being tested regularly at a higher rate than our regular student population, and that's because of their close contact with others, including student athletes from other schools. And we've also instituted pretty wide-scale testing for students who are traveling with groups on university travel, or competing in other competitions like club sports. And this not only allows us to make sure that before we send a group off, we have some test that indicates we're not sending off someone who would test positive. And it also adds another layer of comfort for faculty and staff who may be traveling with those students, as well, as our faculty and staff are so engaged with our students. We have those testing resources on the Healthy Elon and the Student Health Services website, and folks are invited to look there. And so I think that although we're not able to test everyone every week this year, that we do have a fairly widespread testing strategy to try to minimize and mitigate the spread of the virus.
We have certainly come a long way from this time last year, in which tests were extremely limited, took lots of negotiations to try to acquire those tests, and they were extremely expensive. So we are in a better testing environment than what we were this time in 2020. Our next question is for Kelly Schumann, and it comes from Staff Advisory Council, but it's important really for all employees at the university. And this question is fairly straightforward, but the answer may not be as straightforward, which is, will there be a faculty staff vaccine requirement?
Sure, I will be happy to take that, Dr. Husser. I'd like to start with a few data figures, if I could. The large majority of Elon faculty and staff have already received their vaccination. 98% of our full-time faculty and 87% of our full-time staff are currently vaccinated. So that means about only 125 full-time employees are not vaccinated out of our nearly 1,400 full-time employees. We also continue to see some of the unvaccinated employees decide to go ahead and get the vaccination because of this highly contagious Delta variant. We're also getting vaccinated now that the Pfizer vaccine has gained full approval from the FDA. So of course, we continue to offer assistance if needed whenever employees decide to move forward with that vaccination. Many of you have also probably seen that the Biden administration recently announced a federal rule that will require employers who are covered under OSHA's jurisdiction, which definitely includes Elon, with 100 or more employees to ensure that their workforce is fully vaccinated, or require employees to remain unvaccinated, who remain unvaccinated, let me make that clear, to produce a weekly negative test as a condition of employment. Now, that rule will take effect in the coming weeks. However, there are legal appeals that could definitely delay that implementation for weeks or even months to come. Elon will stand by for direction from OSHA as well as the federal government, and we will always continue to follow the law. Now, of course, if we do implement an employee mandate, there will be an exemption process, just as we had for students who have medical or religious reasons not to get the vaccination.
While we're talking about vaccinations, another question that's come in. Many people are asking about Elon's position on whether booster shots will be required and whether Elon will be having on-campus clinics for booster shots. This issue has been in the news a lot in the past week. Dr. Patterson, what can you tell us about booster shots and Elon's plans regarding them?
Thank you, Dr. Husser. So certainly I would say that the science and the guidance around the need for additional vaccines or booster shots is not clear at the time, and it's evolving. So certainly we continue to monitor multiple sources. Our data team continues to consult with both our state and regional and local authorities about where we are both on campus and in the county, but to also to just continue to monitor what the best advice is and the best practice around offering an additional shot or a booster. As of last Friday, the FDA recommended booster shots for people 65 and older and those with medical conditions that put them at high risk from COVID. At this point, those boosters can be taken anytime after the 6-month period from their last vaccine. The FDA did not recommend boosters for those under 65, which includes most of our staff on campus. The federal government, again, continues to evaluate its guidance around booster shots and to plan for booster shot distribution if necessary. And just like with the original rollout of vaccines in our state, Elon was one of the first 3 institutions to be granted permission to administer vaccines. We administered almost 3,000 vaccines in about 8 weeks last year. And so we are ready, on the ready in the event that that becomes guidance from the state and that the vaccines become available to us. And so we're continuing to monitor it. We certainly would follow best practice around how and when and what type of vaccine, whether it's Pfizer or Moderna or Johnson & Johnson. We actually gave all 3 of those vaccines on campus last spring. And so we want folks to be assured that we're going to stay on top of it. And once we get guidance from the state, clearer guidance on the state that might affect a larger proportion of the community, that we will certainly be on the ready to plan those opportunities.
Thank you, Dr. Patterson. I know that this is a lot of time spent preparing for this, and we responded well, I think, last year in getting shots in arms. Our next question is for Dr. Stein. We have a question here from Academic Council and many faculty at large related to class attendance. What are the policies in place for students who test positive for COVID or those who have been close contacts with positive cases? How do students who are in isolation, who don't believe they should be in class because of any kind of illness, stay on track with their academic requirements? Dr. Stein, do we foresee bringing back Zoom or hybrid classes?
Thank you, Dr. Husser. I'm waiting for when you're going to come up with some easy questions to ask us. I guess I won't hold my breath. This is a great question that affects students, faculty, and staff. And the short answer is we are not planning to bring back full Zoom or hybrid classes. Last year we were in person with some hybrid when we didn't have vaccines. This year we have vaccines and more tools at our disposal. But more importantly than that, I think, is a message about faculty and some suggestions for students. And I think it's important that we understand at the baseline here that faculty care about students. That's why they come to Elon, and Elon faculty have created the teacher, scholar, mentor model. And I say this because I think it's important to remember that while Elon faculty are certainly experts and scholars, they are equally teachers and mentors who care deeply about students and their learning. I know that missing class due to illness or quarantine or isolation creates a lot of challenges and is hard for students, but faculty are in the role of determining the best ways to support students and their continuity of learning. And they're basing those decisions on their discipline, on their teaching methodology, and the course itself. So some faculty may choose and are choosing to use a temporary Zoom option for students in quarantine. Others may just encourage students to connect with a classmate for notes and to talk to the faculty member over email or Zoom or phone. Probably the key message for students here is if you are placed into quarantine by the university or you have to miss class due to illness, you should reach out immediately and regularly to your faculty to seek guidance and support and to clarify, due dates, instructions on assignments, expectations, that sort of thing. The open communication will be helpful as faculty try to support students through this time. Now, there's other ways the university is providing support where students can gain support through Belk Library and the staff there, the learning assistance staff, the writing center, tech services. All those groups are ready to help students. The other piece is, I think, the best guidance for students and faculty and staff who feel ill can be found ill or are a close contact, with a positive case. That can be found on our website. So there's information about if you're ill and how you should wear a mask and distance and contact a medical professional for evaluation. There's information if you're vaccinated and you've been close contact with a confirmed positive case. There's information if you're unvaccinated and you've had close contact, and really good guidance there. People need to be wearing masks and to be thoughtful about how to protect others' health. And, that may mean getting tested, it may mean other things. And we're seeing students doing a great job of wearing their masks, but also getting some medical attention. But I think the most important message here to students is professors care about you and your learning, and they want you to succeed. So reach out to faculty, reach out to your classmates so you don't fall behind. And that may mean lots of different modes, phone, email, virtual office hours, whatever it is. But clearly together, faculty and students will make this work.
I'd highlight again something you mentioned in your answer related to the Healthy Elon website. So much about COVID-19 changes on a regular basis. We're responding to case numbers in our community as well as on campus. Different things emerge. So the website is updated on a regular basis. Something you've shared with me a lot is that the FAQs that exist now will be updated on a regular basis. So if people have questions, and we see lots of those, I know that you're going to make sure we get new information up there. So I want to highlight to visit that Healthy Elon website. So
That's a great point. Sorry to jump in. I'm glad you said that. And I think we all get tired, right? We don't want to go back and read the website, but we're trying to keep that up to date. And sometimes that is the best place to just get the baseline information. And in the next few days, we should be sending out some additional guidance for students and faculty around absences as well.
Great. Thanks again. Dr. Barker, my next question is for you. Before I get to the question, I just wanted to point out how involved student life and your area within student life has been over the last year of responding to quarantine and isolation, of working last year through all the different levels of policy that we had, responding to levels of cases on campus. And so I think you'll have this answer on the top of your head. And so we've had some questions from many groups about how long the indoor mask policy will remain in effect and whether Elon will plan to reduce classroom capacities, whether it may be necessary to bring back some of last year's restrictions, like closing residence halls or grab-and-go only services at dining halls. That's several questions there. But I'm wondering, what is Healthy Elon Committee talking about on many of these issues?
Thank you, Dr. Husser. Healthy Elon meets weekly and the data team meets twice weekly. And there is robust discussion about all of those questions. Both groups receive reports and we are up to date on the numbers of new cases and new active cases and the trends on campus and in the region. Of course, the high vaccination rate on campus is a big game changer this year. Students who are vaccinated and show no symptoms don't have to be automatically quarantined if they are exposed to someone with COVID. With that high vaccination rate that we talked about, we haven't had to resort to the same number of restrictions as last year. We are trying to balance safety with student engagement. However, we haven't ruled out any of those steps, the restrictions that we had last year. Although Alamance and Guilford counties appear to beginning to see a plateau in cases, we're going to stick with the indoor mask policy as long as we think it's necessary to keep the number of cases in check. And if we see a steep increase in the number of cases on campus, we'll have to take another look at the steps we might take. We all just need to be flexible and ready to adapt as the virus continues to evolve and we learn more about it.
Thank you, Dr. Barker. Kelly Schumann, here's an additional question from Staff Advisory Council, and it applies to both faculty and staff. A number of folks are looking for more information and clarification on the continuity of work and instruction policy. Could you explain what the continuity of work and instruction policy is all about?
Sure, I would be happy to. So just for a reminder to anyone, you can view this policy in its entirety on our HR website under Guides, Policies, and Procedures. Of course, our number one priority is for any employee who may be out due to COVID or COVID-related circumstance that they first care for themselves or their family. In addition to our sick, vacation, personal, and leave of absence policies, we have developed a temporary continuity of work and instruction policy to further support our faculty and staff who may need to be temporarily away from campus due to COVID-19 illness or closures during the fall of 2021. The definition of temporary for this policy's purpose is a total of 80 hours for our staff and 10 business days for our faculty. Now, there are 3 instances where this policy may be applicable on a short-term temporary basis. First being quarantine or isolation due to a COVID-19 exposure or a positive test result for yourself as an employee. Second, caring for an immediate family member's illness related to COVID-19. And third, remaining at home due to a daycare or school closure that has been related to COVID-19 as well. Now, not all positions have duties that allow our employees to work away from campus. In these instances, the employees will work with their supervisor as well as human resources to discuss any leave options that may be available to them. To assist our faculty and staff, we have developed an electronic request and approval process that is outlined on our website on the HR page, again, under Guides, Policies, and Procedures. If any employee needs assistance to request either the continuity of work or continuity of instruction, please feel free to contact the Office of Human Resources at any time, and we'd be happy to walk them through that process.
Thank you for that information. I'm really hopeful that I do not have to call your office related to this policy, but I'm very glad to know it's there if I do. Dr. Stein, I have another question for you. This relates to the academic calendar for the remainder of the semester. Is there any talk of wrapping up campus instruction at Thanksgiving and finishing the semester remotely like we did last year?
No, we are not making plans at this time for that. No decisions have been made to wrap up this semester early. Based on the projections we're getting from local health experts, that is not in the plans. As you heard mentioned earlier, it's a little early, but we believe that we are beginning to see sort of a plateau with the spread of the Delta variant. An initial plateau, let's say, locally. And it's too early for us to let up any of our precautions, but like everything else in the pandemic, things can change. So we have to be ready. But I think at this point, our message is really stick to our Healthy Elon precautions, keep an open mind as we review the best course of action. But to be really direct, no, we are not planning to end the semester early.
Thanks for that, Dr. Stein. Dr. Barker, as you well know, this weekend is Family Weekend. We are looking forward to welcoming more than 2,000 families who are registered to attend. How are we going to keep everyone safe and healthy this weekend?
Yeah, so we are on track to set a record for Family Weekend registration and attendance this weekend. This calls for an extra measure of caution on everybody's part since we will be welcoming so many off-campus visitors. Please be extra vigilant about wearing your mask indoors. Let our visitors know that we are serious about this requirement and they will follow our lead. Remember, we encourage masks outdoors as well in crowded areas and in places where you cannot distance. If you see someone indoors without a mask, please remind them of our campus policy. Remember, the mask policy also applies to fall convocation with Carly Lloyd on Friday afternoon in Shar Center. And we suggest everyone wear their mask at tailgating and the football game this weekend. We want everyone to have fun and enjoy Family Weekend, so please protect yourself and others. Wearing our mask is the best way to protect vaccinated and unvaccinated people.
Thank you for sharing that. Dr. Stein, another question for you. This question was actually a request made at last week's SGA, Student Government Association meeting. Can the campus COVID dashboard be updated more than once per week? Dr. Stein, you announced a change in the dashboard last Friday. Can you tell us more about that?
Yes, this came from requests like this one from students, faculty, and staff, and parents, just for a little more data. And so we worked with IT and university communications and quarantine and isolation staff and others to make the move so that we could have a little more data visible on the dashboard and to have it updated Monday through Friday. And the plan is to do that while we're in this surge from Delta. We started this summer, we didn't have students, very many students on campus, and we were in a different time. So like most campuses, we weren't updating the dashboard regularly. And then as we started to begin the year and there were some cases, we started getting these requests, and we just wanted to be transparent and avoid misinformation. It's a little strange now that we're coming down from a little bit from this first Delta surge, but it just, we want people to know exactly what's happening in both on campus and in Alamance County. So that was the goal here. And, I think it's important that we know that COVID's going to keep being a little bit like this. We may see surges in the future as we come back inside and in, cold and flu season in the winter. But our focus needs to be sticking to the precautions we know that work and trying to not only protect ourselves, but others in our community and supporting each other. All this is hard. It takes extra work from all of us. And so I think our group really wants to ask that we come together as a community, continue to, and continue to support each other. And these questions, although hard, are really important. And so, we're not perfect and we make mistakes. And so I would just close this part. My response was saying, keep sending us questions. It's helpful to us. We need to hear your questions and concerns, and we'll keep trying to answer them in this fashion and others.
Thank you for that. That concludes my questions for this discussion. I want to thank our panelists again, Marquita Barker, Assistant Dean for Campus Life and Director of Residence Life, Janalyn Patterson, Associate Vice President for Student Life and Dean of Students, Kelly Schumann, Associate Vice President for Human Resources, Jeff Stein, Vice President for Strategic Initiatives. Before we close, I'd like to offer Dr. Stein in his role as chair of the Healthy Elon Committee, if he wanted to have any sort of wrap-up messages of things that he really would like our campus community to know in the week ahead.
Yeah, I probably jumped ahead a little bit on that, but I think I would say, you all know people who are on the Healthy Elon Committee and the Data Committee and the Infectious Disease Response. And we ask that you always reach out to let us know what you need. We hope that you're staying on top of that John Dooley email, that Dr. Dooley's email comes out every Wednesday, and we try to put pertinent information in there and new information, and certainly on the Healthy Elon website. And most importantly, I think our message is thank you. Thank you for submitting these questions, for working hard to keep us all safe, and just for the continued vigilance through this strange time where we've got a lot of shifts, but we do this together, and it's taken all of us. So thank you.
We appreciate everyone who's watched this panel discussion of COVID-19 in fall 2021 at Elon University.